Hi guys, my name is Kat. I'm currently the RN LVAD coordinator. We are making a couple of educational videos so you guys can get little quick education snippets to make you more comfortable taking care of the patients at the bedside. So one of the first ones we're going to cover is equipment. So the most important piece of equipment, probably for your patient besides the pump that's running their heart, is your system controller. Okay? This records and stores all the data that's happening with the pump and your patient. And also your drive line from the pump connects here, and this is what's going to deliver power to your patient 24/7. There are two power sources they can be connected to: battery, which we'll discuss when they're ambulatory, and wall power when they're in the bed. Okay? From the system controller, these gray cords are your power cables. If you notice, you have one white lead and one black lead. They both give power, but the white one has an extra wire that actually gives the data on the screen. So if you ever want to see data, it's the white cord. So when you're connecting to wall power, it is white to white and black to black. Moving on to another power source, your batteries. So your battery is a 14-volt lithium-ion battery. For your HeartMate 3s, they give you about 16 to 18 hours in a pair because they drain simultaneously. To give the system controller a place to connect to this battery, you must use a battery clip. Okay, make sure that this here is flat. You're going to line up arrow to arrow and you're going to click. That's how you know it's working and it's not broken and it's beautiful. Remember, black and white make gray. Your clips are gray. Either cord can go to any clip, it's universal. The only time it matters is when you're connecting to wall power. Okay, so that's your controller, your battery. Remember to check battery life, you can hit here, or you can check on the system controller. Your battery clip. Another wall source for the power is your power module. When the patients are in ICU and being monitored and they're not up and ambulatory, they should realistically be on wall power. But if you're on a unit and they're up and independent and moving, your patient should be on battery until they go to bed at night and you put them back on wall power. These green lights always have to be on before you connect a patient. When the unit is not being used, it has to go in a hallway and it needs to be plugged into a red outlet to make sure that this is always charged. The last piece of equipment we're going to talk about is your system monitor. This is where we have all of the patient data and we can manipulate certain things to optimize the VAD for the patient.